Hi, my name is John Zender. I picked chapter 15, neoplastic disorders, for the project. I specifically trimmed it down to small cell carcinoma of the lung in order to adapt it to the subject student. The student in this case is Mary Jenkins. Everything's pretty much the same as before, except that I gave her a recent diagnosis of small cell carcinoma stage 4 that has metastasized to one of her kidneys. And I also gave the patient a pack a day smoking habit, and she claims to have quit 3 months ago. Hi, Miss Jenkins. My name is John Zender, and I've been asked to teach you about your lung cancer that you've been recently diagnosed with. Lung cancer is a type of cancer that typically starts in the lung. Cancer in general starts when the cells of the body begin to grow out of control. They divide and they spread and they become tumors, like in your case, in your lung. Now you're saying to yourself, well, what does metastasized mean, or metastasis? Well, when we say a cancer has metastasized, it's moved from its origin point, and like I said, in your case, your lung, to a different part of your body, such as your kidney, like in your case, your left kidney. But in general, anytime we say that a cancer has metastasized, it is moved from one part of the body to another, either through the bloodstream or through your lymphatic system. Parts of the cells of the cancer break off from the original tumor and they travel around the body and start new tumors. That is metastasis. Now you say, what is a small cell lung cancer? It's small cell lung cancer is also known as oat cell. This is because the cancer looks like dried oats under the microscope. It often starts in the bronchi, which are the tubes that connect from your upper airway to your lower airway down into your lungs. This cancer grows very quickly and spreads to other parts of the body fairly easy. This type of cancer represents fewer than 20% of all lung cancers, but is typically caused by tobacco smoking, which I see you've had a pack a day history, but you claim you've quit 3 months ago. Now, typically, small cell cancers are divided into two groups. They're named for the kinds of cells that they're found in and how the cells look or are viewed under a microscope. Uh, like in your case, you have the small cell carcinoma or oat cell cancer. Uh, and there is a second type of small cell cancer called combined small cell carcinoma, but we're not going to cover that in this lesson. Treatment options. Now, you do have various treatment options, and the doctor is going to go over this with you, but I am going to explain a few of them here for you, and hopefully that'll help you make a better informed decision about your course of treatment. Now, obviously, the major treatment option here could be surgery. You've already had surgery performed on you when they did the biopsy to confirm your cancer diagnosis. They can remove tumors through surgical means. These things kind of depend on the factors, such as what type of tumors you have, the location, the size. Are they wrapped around an artery? Can they get to them? They're going to look at certain factors like your age. You're 55, you're still a good candidate. They're going to look at your physical fitness, your other illnesses. I see here you also have diabetes that might play a role in the decision. But if the doctor thinks that they can help you, they will try with surgery. But typically, surgery is combined with other cancer treatments, such as chemotherapy, radiation, other forms of treatments in combination in order to try to mitigate the before and after effects. I'll go over that a little more next. Chemotherapy is an obvious choice too. I'm sure there people have told you about chemotherapy, or you've seen them. They've lost all their hair. Uh, they've lost their appetite. It can be used as a primary treatment to destroy your cancer outright. Or again, like I said, they can use it before. Like let's say your tumor is wrapped around a major artery, and they need to shrink it in order to get to it. They may use chemotherapy to do that after a surgery, maybe, in order to again mitigate the reoccurrence of your cancer, or in some advanced cases, just to relieve symptoms. Maybe it's kind of like the last ditch attempt to kind of get some more quality of life back. Radiation therapy is another good option. Again, it can be used as a primary treatment to destroy the cancer outright, hopefully. Um, in a perfect world, they would target just the cancer, but even nowadays they've gotten better with tighter beams of energy of radiation to target only the areas with the cancer and not just like the whole region of the body like it used to be. Think instead of opening a window, you're opening a pinhole and going right at the cancer. Again, this can also be used prior to a surgery in order to shrink a tumor, so that for the same factors to try to get to it, to lessen the risks associated with the surgery, or afterwards in order to clean up, make sure that there's nothing left over that can cause another tumor to reappear, and then you're right back in the same boat. But chemotherapy, radiation therapy, they both have their side effects. There may be hair loss, loss of appetite, lowered libido. You may be more likely to get an infection. Um, Things of this nature. Again, you're going to want to go over these with your doctor too. But I just want to give you some uh, overall information, so you can make a better informed decision about your course of therapy. Immunotherapies. Immunotherapies are fairly new. Immunotherapies use your immune system to attack the cancer, to go directly at the tumors. There's no, I'm not going to say that there's no side effects, but they're either super severe or the cancer just disappears. It kind of depends. It's on a case-by-case basis. Um, because it is such a new treatment, there are no long-term studies to show the effectiveness over time. So, you're going to have to talk again with your doctor and see what he or she thinks is the best course of action here. If this is the way you want to go, maybe they can give you better heads up on what they're doing locally. But these therapies typically go right at the cancer's ability to hide itself within the body, because cancer is part of your body that has grown out of control. They have the ability to either inhibit the immune system or mimic healthy cells. This is how they stay out of the crosshairs, if you want to say, of the body's own immune system. There are currently two types of immunotherapy on the market right now. One's called checkpoint inhibitors. The checkpoint inhibitor disrupts the cancer cell's ability to, like I say, bypass or inhibit the immune system. So, hopefully it's kind of like you unmask the cancer and say, hey, here it is. And the immune system says, oh, hey, that's a foreign body. Let's go after it. The second way is they kind of provoke your immune system into a severe response through a protein called cytokines. Now, this could hopefully attack the cancer. There are side effects with this too. The cancer could be killed, but your immune system just keeps right on ravaging. Again, like I said, you're going to want to talk to your doctor, find out if this is the route you want to go. Another thing we want to talk about is lifestyle changes. Now, you say, you had a pack-a-day history and that you quit 3 months ago. That's fantastic. We want you to stay off the cigarettes. Here's a website for you that can probably help you stay on the wagon. We're also going to administer a test after this slide presentation so that you can we can kind of gauge how well we're doing. We want to know how much you've learned. You know, of course, if you have any questions, concerns, don't hesitate to reach out to us. Thank you very much, Ms. Jenkins. You have a fantastic day.